Hey, everybody. Welcome back to another episode of the Horse Geeks podcast, where we look at horses and riding from the inside out. I'm Kirsten Nelson, professional horse trainer, and with me today is a special guest, Dr. Anne-Marie Hancock of True North Equine in Bryce, Virginia. Boyce.
Marshall.
Marshall. Sorry, I had that completely wrong.
That's
Marshall,
okay.
Virginia. And you're laid up so I get you on the podcast. Yay, because
Yeah.
you're a bit laid up as you're healing from a broken bone. And the last episode Deb and I did, we talked about why horses stumble, because I get that question a lot. And all we talked about, because we didn't want to touch on the kind of deeper lurking issues that are more medical related than they are related to either the toes being too long, or I find when I'm actually helping horses change their mechanical coordination, sometimes it's just part of the process and it's not necessarily a negative thing. They just don't know where their legs go at certain periods of change.
Absolutely. They're learning new muscles and new ways to move. And yeah, it takes them a little while.
Yeah.
Mm-hmm.
But one of the things I wanted to talk to you about specifically was kind of about Lymes and EPM and inflammatory issues, because I'm finding through the years, it took a while to get through my thick head, that some horses were just super slow in their training. They just were really struggling to change their coordination, to progress, to find ease of motion and have things smooth out. And most horses will they like the work because they feel better and they kind of go bink, bink, bink through the training, even though it's physically challenging. But the horses that get really stuck, I've learned to talk to the owners about testing for EPM or Lymes, or after talking to Stephanie, maybe trying a diet change and getting them off of those inflammatory foods. So I wanted your perspective on that, because almost every time, like those three major issues start to show up in the horse really struggling through training, but it's not a quick onset. And I think
Right.
that's the problem, is that it kind of just, it's easy to call the horse lazy, or we think the horse is shutting down, or the horse just doesn't have the right conformation. And I don't find that to be true, except with when there is a Lyme's issue or EPM issue or some kind of inflammatory issue. And I had one client recently whose horse was really struggling, and she changed the diet to the forage-based diet. And about a week or two later, when that inflammation was coming out of the muscle, all of a sudden we saw on his weaker hind leg, there was no muscle. It was completely atrophied on the right hip. And I go, you need to like call the vet
Yeah.
about EPM. I said, and he was, I think he fell over once. And so I go, yeah, that's like not a training issue.
Right. You're fine.
Yeah.
But I do think, like you said, it's slow and progressive. Um, so I just went to a talk from Trina actually last night, and they have a couple of studies. They're trying to they created a probiotic, and so they're trying to prove that they can decrease inflammation in the body um, with their probiotic. But they did this study where they showed that, even when a horse is exercised, just in a general way, there's a huge increase in inflammatory mediators that takes at least 24 hours to go back down after a period of exercise, right? So if we just take that without talking about the rest of the Purina research, right? We're just talking about the fact that we know that inflammation goes up with work. If you have a horse that can't clear that inflammation and it takes it 72 hours to get out of the body, and you're doing exercise every day, right? So you're never getting back to baseline before you're adding more, then you end up with this huge amount of excess inflammatory mediators in the body. And over
Mm,
time, if those are accumulating, the liver has to process all of that, right? So if the liver isn't able to process it because it's an overwhelming amount, because it's, amassing over time,
Right.
then you end up with inflammation that the body has to figure out what to do with all these extra, enzymes and cytokines that have been released, right? So what do they do with it? They store it in fat, which is what we talk about as when we talk about inflammation being the fat pads in the body, that's what we're talking about,
Right.
right?
So it's
So,
not always just a weight issue, the horse being
right,
overweight with a cresty
yes,
neck or the saddle pads or saddlebags and the either
right.
side of the butt. Yeah.
It's often a really good indication of chronic inflammation. And I think that's why. So this study that Purina did, they were trying to prove that their new probiotic is supposed to decrease inflammation. And what they were able to find is that by using that probiotic that they have, they could get the inflammation out in 24 hours versus 48 or 72. So regardless of whether or not we want to use Purina products,
Right.
what we can say is that a healthy microbiome or good nutrition, right, where you have the right bacteria in there, can probably help decrease how long it takes to clear the normal inflammatory mediators that occur in a body with exercise, right?
Interesting. Even though
Right.
it's processed by the liver, it's really the gut, the health of
The
the
gut
gut
helps.
can
Yeah,
help
it can help
process
with
that
that.
inflammation faster.
I think that the healthier the gut is, the better those bacteria are then secreting things that are being absorbed that are able to help with, like, maybe free radicals or antioxidants that are helping to scavenge, the free radicals, right? Or maybe you're just getting things that can help with anti-inflammatory components in them versus just, the pro-inflammatory components that you might have, right?
Right.
So I think that's probably why the gut is so important. So I think that that is like, okay, let's say step one is a healthy gut to improving inflammation. Well, I think step one on the pathway to EPM and Lyme is an unhealthy gut, right? Because if
Ah,
they have poor bacteria in there, or they're unable to help with this inflammatory process and help decrease the inflammation in the GI tract, then you're gonna have more of it in the body,
so
right? And
that's where you're going to have a horse that maybe takes 72 hours to process the inflammation from exercise versus 24.
right, and if you're, saying like these are the horses that maybe are a little lazy, or they're more tired, or they seem to not want to do as much, right? Maybe they're stiffer. I think that's probably what we're seeing, is that they're just a little more inflamed, where it's harder for them to come back and work the next day.
Yeah.
So it might be where if they only ride once a month, they're never gonna know this, right? But if they're used to riding maybe once a week, and all of a sudden they start riding 3 days in a row, and then, giving me a break, maybe they start noticing on that third day, the horse is really tired. And
Mm.
instead of just putting it up to, well, I just rode hard and they're tired, maybe we need to think about the fact that they
There's
have a,
inflammation accumulating that they're not
right.
processing through.
Right, it's just a different way of thinking of it. So I think that's probably step one. And then I think along with that, as the GI tract gets more inflamed, then we talk about it having, a leaky gut situation. And I know that we've kind of progressed beyond the term leaky gut, but it's something that lay people understand. So I'm going to use the term, even though we
Oh,
don't
good, because you can
really.
explain it to me. I've heard leaky gut, but I don't really understand what that means.
So I think initially when we first started talking about it, it was very basic. And what we were thinking is that there were areas in the lining of the gut where you have all these little villi, these little finger-like projections. And those were getting fragile. And so there were openings in there where the gap junctions weren't being held together. And so then bacteria were getting through that and into the bloodstream.
Mm.
Um, I think it's a lot more complex than that. Um, and that's why, I mean, that was the original thought, but I think now that we know there's so much more, that maybe it's not that it's necessarily porous, But those gap junctions maybe aren't functioning the way they should be. And there's a lot of theory now that there are different connections between the cells that have to do with almost like a camera aperture. If you can imagine that there's light that's supposed to go through that camera aperture,
Mm-hmm.
and those little camera aperture junctions between all the cells are what allow the cells to communicate and work as like huge organisms to function and improve health. And I think that that is what's getting mismatched, and it isn't communicating correctly, and those junctions aren't functioning and they're not opening correctly. So I think we end up with like a whole, I don't know, a lack of communication and synchrony with the
Mm.
cellular components of the GI tract. And then when you put that along with the fact that there's a huge section of the immune system that sits in the small intestine, kind of right behind that lining,
Yeah.
so if we have a lack of communication and synchrony, and maybe we have a few more bacteria that are getting through than they should be, and then the immune system is right there, then you end up with a whole lot of problems with immune reactions in the body.
So that's starting to suppress the function of the immune system. And that's really pretty direct. I've never heard it put that way. That explains a lot
Yeah,
why the gut health is so related to the health of the immune system, because it is right
yeah.
there. Yeah.
It is. The ileum, which is the last section of the small intestine, has like 80% of the lymph follicles, and that's where we sort of experience the world, right? So the body like sends all this stuff in, and the immune system is right there to be like, we want this, we don't want this, we're gonna attack this, we're not gonna attack that, and it's all right there. That's why we talk about why allergy testing is so hard to understand, right? A lot of people do all these blood allergy tests to see what they're allergic to for foods. And animals, a lot of times they show up being allergic to everything they're eating. But I
I
mean, a
have one
big
of
part
those
of
at
that
my
is,
barn. Yeah.
right? Like of course they're gonna show up as being allergic to everything they're eating because their gut isn't functioning correctly. So that stuff is getting through and it's being overexposed to the immune system because the immune system is right there. Right. So it's not that they're necessarily allergic to it. It's just that that's the stuff they're being overexposed to at that point.
Well, it's interesting that particular horse is allergic to all known horse foods at the time except alfalfa. And
Mhm.
so and then I knew I needed a fat supplement, so he was on that diet that Stephanie recommended. He's been on it for years, and that horse had a personality transformation in 3 days of changing that diet.
Mhm.
Yeah. He went
Right.
from
Just getting all that
unruly.
out.
Yeah. Like he was the reason we got kicked out of a lot of different barns because he was not easy to handle. And
So, I mean, that kind of is exactly it, right? Like, we really need to think about how much what we're feeding causes that inflammation and causes all of the miscommunication I'm talking about. Like if we talk about that as being something related to glyphosate and, what most of our foods now are, grown in Roundup, they're GMOs and whatnot, then we already have that in the food. And so there's all these different things that add into that. But it
yeah,
is
but if
always
you're like you're saying, if you're layering inflammation from work on top of inflammation from feed, on top of, and you're affecting the immune system so directly, it's just going to open the body up for any virus that the wind blows through.
right.
Or maybe that's why some horses, I had one horse at my property get EPM and the rest of them are fine. But he also had a compromised immune system. I knew that. He had a lot of
Right.
physical issues. And of course, he was the one that wound up with EPM.
But yeah, that's exactly right. Is you end up with whatever horse has the weakest immune system, which is often a big part of that is the gut, then they're the one that gets the disease. Or sometimes you'll find like it's the horse that has the highest fecal egg count, right? Because that's a
Right.
hint that that horse probably already has a poor GI immune system. right? And so if they're the one that always comes up with that high fecal egg count, then they're probably more at risk to get EPM or to get Lyme, because we already know that their immune system and their gut isn't functioning as well as it should be.
So they're more
Right.
susceptible to the parasites and the
Mhm.
viruses and the illnesses.
Yep, you
Absolutely.
got it. Mhm.
No, and it's been a godsend having the conversations I've had with Stephanie just about the diet change, because I'll come across, like, I sort of specialize in horses that are difficult, so I get a lot of them. And some of them are just so slow to progress that I'm like, it always tells me there's a physical reason. Like, I don't believe that they're
Right.
lazy or stupid or whatever. I go, no, there's a physical reason. And changing the diet for a lot of them has just transformed. Like, just
Oh,
getting rid of
absolutely.
that extra inflammation from the diet. And it shows up in so many different ways. I go,
Well,
some
that's what we're talking
horses,
about, like with the inflammation in the body, they can be more prone to lameness, like to injury. They can, maybe they're more likely to get tendon or ligament injury or tear, right, because of the inflammation, or they might, like we said, have a higher fecal egg count. They might get ulcers, hindgut or foregut ulcers. They might have more muscle fatigue if we're talking about them being more tired. So they might have poor performance. I mean, it can be all kinds of different things.
yeah.
Mhm.
No, and even like in some horses who change into this diet, it will look like they lose a ton of weight right away. And what I
Mhm.
realized, because the other horses didn't, not every horse looks like they lose a ton of weight making this diet change. But I go, oh, so some horses are holding the inflammation sort of in their muscles.
Mhm.
And the one horse I had that looked like it just took the air out of her body within a week. It was like her body just deflated. She went from looking like an easy keeper to looking like a rescue horse. And she was also the horse that had 5 lipomas that had to be
Wow.
surgically removed.
Uh-huh.
So I go, and she was on senior feed her whole life
Mhm.
but never really wanted to go forward. An Arab who doesn't want to go forward. And I could never figure it out. It was, and that was the key.
Just decreasing the inflammation in the body and then allowing her to get the appropriate fuel to move forward.
Yeah.
That's really cool.
But holding it in their muscles, or like you said, coming up lame, or maybe it shows up as ulcers, maybe it shows up as like it seems with Lyme's and the food inflammatory response, it's a wild card. Like, I see symptoms that are like all over the place. I go, EPM symptoms are a little bit more EPM-ish. But I go
Yeah.
sort of general inflammatory, or like you're saying, weak immune system, the problems can manifest in such different ways for different horses.
Well, I definitely think that from a body standpoint, when Callie and I go out and do osteopathy on horses, we are often finding EPM or Lyme based on tissues, like substance, like how does the tissue feel? So, you're kind of catching it before it gets to the point where they have all the other issues, so a typical Lyme horse, if we're waiting for the owner to start to be concerned. Oftentimes what they'll complain about is hypersensitivity, overreaction, maybe they're bucking or rearing, or their behavior is very different than it used to be. They don't want to be touched, those sorts of things. Whereas EPM, oftentimes the owner will say, like you're talking about, stumbling or weak behind, or maybe they're more fatigued than normal, or they just don't seem to know where they are in space. But both of those, it can be tricky because when you feel them when they're kind of more on the beginning stages of it, a lot of times they're just really tight in their muscles. And so when you go to work on them and do osteopathy or chiropractic or massage or any sort of body work, when you get your hands into the tissues, instead of feeling pliable, like when you do work on tissues, you can kind of feel your hands go on top of the tissue, and then you'll feel your fingers sort of drop in, so you can find
Mm-hmm.
the different layers of the tissue. And when you go to try to feel a horse that has EPM or Lyme that's active, oftentimes when you kind of touch the top, you can't get beyond that. Like everything is so bound up in the fascia and
Mm.
shifted that you can't feel the layers. It just feels like a big board that you just can't feel through. Or oftentimes we'll find like you are, let's say you're looking at their spine and you're trying to do some mobilizations, and a mobilization that worked, like you mobilized the joint and that you got it moving, and then you go to test it to make sure it's moving and it's not, and you're like, okay, I
Mm.
know I got that. It should be moving, but it's stuck again. And you can try that 2 or 3 times and you'll get that same response where it just doesn't want to hold the manipulation that is effective. So that takes time. You just have to have been doing it long enough that you know what, feeling of mobilization happen should feel like. So you know what it should feel like when you retest it. To be confident enough to be like, okay, this didn't work the way it should.
And
So
that's one
it's
of your kind of early detection signs.
Yeah, exactly.
Mm-hmm.
When we're trying to do the body work and we're just not getting anywhere, where you feel like you're just tired and working harder than you should be and nothing is holding. A lot of times those are the Lyme and the EPM horses.
Yeah, that's very similar to my experience. It's like the horse that just the training isn't sticking. We're doing the same thing. We're being gentle. We're taking our time. We're not pushing the horse, but it's like there's just sort of even the subtle signs of progress are not there, or it feels like you take 2 steps forward and a step back. And what
Mhm.
I notice a lot of times is that in training, sort of that slower than normal progress, and the horse goes towards what we've talked about before, like a dorsal ventral state.
Mhm.
And with good owners, these horses are not being mishandled, they're not being overworked, but it's like they kind of just go inward and start to be less aware of their environment. And I'm now
Mhm.
seeing that for me, those are the two kind of early detection signs, but it's probably a lot farther along than your early detection sign.
No, I
Because,
think you're really right about that, like focus inward, because you do find that, and I don't know if that's because they're inflamed or what it is, but it's like I think that's why they become hyper reactive sometimes. It's not that they're hyper reactive, it's that they're zoned out, like you're talking about. They're in
hmm
that dorsal vagal where they're just not really present and they're kind of numb. And so when they do feel something, it's like they come out of the sleep that they were in and
yeah,
they overreact. And so the perceived hyperreactivity is really them just waking up. But the owners didn't realize that they were in that sort of zoned out,
yeah.
mode. So they see it as an overreaction. That's definitely really common. Where they're almost like in a fog. They're just not really there until they're really there. And
Yeah, and the first sign of progress I see on the other side of EPM or Lymes after it's been
Mhm.
treated successfully is like the alertness comes back,
Mhm.
even if they're still moving terribly and their body still looks atrocious. It's like that alertness comes back and they're calm but alert. And
Right.
I go, the dorsal vagal is like people call it calm sometimes, but I go, no, it's like gone. They're not they're not
Yes.
alert to their surroundings. They're not participating mentally. They're just like somewhere else.
Right? It's like trying to
Yeah.
talk to your kids when they're looking at their phone or
Yeah.
playing a video game and you're like, hey, over
Yes.
here.
Yes.
Yeah.
Yeah.
Yeah, so I would definitely say like early signs, like you're saying, would be that weird fog, where they're not really like they're kind of out of it, the sore muscles, and then the other thing I think that what we see that ties in exactly with what you're saying is that what we find is that if we do body work on horses that have say mild EPM or Lyme, sometimes it can be a little tricky because we'll have some of them where you do the body work and their tissues don't feel so bad, but then we'll get a call like 24 to 48 hours after body work, and the owner will say they feel terrible. Like they are so miserable and so stiff and sore, and I don't know what happened, but it's awful. And I think what happens is we create enough inflammation with all of our mobilizations that we sort of create that inflammatory response and the body can't handle it.
Mm,
So then they get really sore, like they can't recover from it, which is probably similar to what we were talking about with the exercise intolerance, right?
yeah.
Where they just can't handle the work. And I think it's almost like a delayed response. It takes them, you do something and then a couple days later, they're just so sore because they still haven't been able to get through all of that from
Yes.
the event.
Yeah.
I think those are probably the three things I see that are the more mild signs of Lyme and EPM, where I'm
No,
trying to,
and whether we're talking sort of the food reaction or Lyme's or EPM, we're essentially talking about inflammation.
absolutely.
Yeah. Which
Yes.
even if we're
And
doing good work, if the body's in a weakened condition, it might not be able to process that inflammation rapidly.
wait, I think that's probably a good way to put it is that if they were super healthy and they could handle the inflammatory process and the clearing of that with their own natural processes, then they could probably clear EPM or Lyme even, right? Because if it
Because
just
I think
stays.
a lot of horses, like EPM is basically a protozoa that gets into
Mhm,
the spinal cord,
mhm.
and Lyme's is a tick bite that does it create like a virus, or what does the tick bite do?
The tick bite, so the tick injects a spirochete, which is a type of bacteria, into
Okay.
the bloodstream, and then that becomes encysted in the tissues.
Oh, that's right, because
So it travels through the
doxycycline
body.
works, so it's like it's
Mhm.
bacterial. Okay.
Yeah, yeah. So I mean, it's an organism that's wanting to live in the body and stay there, which is kind of what the protozoa does too. It wants to, kind of find little spots to, live and kind of create encysted areas where it can stick around for long periods of time. And which is why they're so hard to deal with because you might have something that was, inserted into the body when the body was healthy enough to deal with it. Like we're talking about, if the body's super healthy, they have good nutrition, everything's going great, they're not stressed, they're able to process whatever's going on. Maybe they get a tick bite or they ingest some protozoa and they're able to deal with the inflammatory response from it, but some of it, stays in the tissues and kind of goes dormant. And you can have a response years later because they go through a stressful event or they go through a starvation event or they're all of a sudden they're performing all the time instead of hanging out in the pasture or they lose their best friend or whatever it is. It can be, all of these things can cause enough stress or inflammation over time that then something that they could have ingested or been infected with years before can even be brought to the surface. It doesn't have to be a new infection.
No, and that's exactly, I think, what you're describing happened to one of my personal horses. And it turned out he had fractured his coffin bone hoo-hawing around a paddock and had stepped on a sprinkler head.
Oh
And I
gosh.
thought it was just an abscess. He laid down. I gave him some Banamine. A day or two later, he abscessed, and I'm like, oh my gosh, he's super sensitive to abscesses, and didn't
Mhm.
think more of it. And then he kept abscessing in the exact same spot coming out of the coronet band, exactly the same spot, about every 6 to 8 weeks, a new abscess. And we had
Okay.
X-rayed him. We X-rayed this hoof like twice. I had the vet out to shoot X-rays because I'm like, why does he keep abscessing? And then my farrier goes, have you done a sky view shot? Because none
Hmm.
of the X-rays showed anything. We were doing laterals, medials, front, back, and nothing. He goes, have you done a sky view shot? So we did that, and sure enough, there was an old fracture that had turned into a bone infection,
Oh gosh.
and it was nasty. So of course, where he's on the uber expensive hand compounded
Right.
bone, antibiotics, install rest. We got that to heal. He did better. Finally, I could throw him out in the pasture. And I got to say, within 30 to 60 days, after healing the bone infection.
Uh-huh.
He came in from the pasture one day ataxic, like almost fell in the bushes.
Uh-huh.
And I went, "Oh my God." And sure enough,
Right.
I like, thank God a decade ago, EPM testing was a nightmare.
Yes.
And now, is it Davis that does the
There's
EPM tests?
Davis does one. Most people either send to Kentucky or Davis. I like the Davis test the best because they give you that little like percentage chance that they have active infection based on the number, which is just kind of nice to have a numerical estimate of disease. So I
So
like
can
that
you go over
better.
that protocol? Because I still have clients who don't know how much better the EPM testing and medication is now. And
Sure.
I think you even have your own protocol for EPM.
I do all kinds of interesting things. So
Okay,
yeah, there's all kinds of things you can do
because
to
now it's a
test and
blood
treat.
test. It doesn't require a spinal tap.
So, I guess I should say that depending on which veterinarians you talk to and where they are, you're gonna get different answers on what to do. So
Okay,
you have different choices for diagnostic tests. And most veterinarians will use either the UC Davis or the University of Kentucky test to test for EPN. The University of Kentucky one just gives you a number, so you need to have enough experience with that number to know what it means.
okay.
So it'll be like 1 to 500 or 1 to 2,000 or 1 to 5,000. And in general, what most people do with that number is if it's over the 1 to 2,000 mark, they treat. And everybody has their own decision if it's below that. The UC Davis one tests for sarcocystis and neospora, which are two separate protozoa.
Mm,
And in general, I tend to see more positives for the actual EPM protozoa, which is the sarcocystis. But you can see neospora positives as well. I think it's more common on the West Coast than the East Coast. I
okay.
usually test for both because you never know. So you'll get a test for both, and then based on how high that number is, it'll usually be like it's either like it's in eights, so it's like 1 to 32, and then 1 to I don't know 160, and then 320, and it goes up like that.
Yeah.
So usually I think if you're above the 320 mark, 1 to 320, they consider that to be relatively positive. But again, you still have to take that result and then use your own experience, to
Yeah,
decide how to deal with it.
my horse was 1300 something,
Right.
right?
There's no question. When they're
Yeah.
high like that, you treat. I just got a test back today that was negative, negative. So we still get negative tests. And negative tests are great because then you don't have EPN.
Yes.
Positives are hard. So there are still a lot of veterinarians that will encourage spinal testing, and that is the gold standard. And I think it's a lot to put a horse through, in general, to go through spinal testing. Most people are doing it standing, and a lot of the clinics that do it are using a spot in between the first and second vertebrae in the neck,
Oh,
instead
interesting.
of doing the one that was like they were trying to go right in the lumbosacral space before, which is really
Right.
hard.
Right.
So if you really wanted to know, you can do the spinal tap, and then what they do is they send off samples of both. So they send off the spinal fluid plus the blood. And what you're looking for is a tenfold increase in the amount of antibodies between the two. So you should have a
Oh,
whole lot of them. And so that's how you know that you have active infection. I don't typically do that because I think it's pretty safe to treat. I think that we end up treating a lot of other maybe coccidial organisms and other protozoas in the process of treating, which is probably a good thing. So in general, most of us just do the blood test and then treat versus doing the spinal tap.
yeah. And like the marquis and the protozoal were explained to me as a more targeted antibiotic. So it's not going to go in and wipe out the system like a lot of, I mean, it'll still have the effect of like an antibiotic, but it's more targeted to that And tell
Mhm.
me if I'm wrong. That was just my understanding of how it was sort of explained to me.
I think they're supposed to be like more static versus sidle. So static means what they do is they prevent the bug from growing. I have a cat that's being really needy,
Oh,
so he wants
I
to come in.
locked mine out today. Yeah.
No, I can too, but he's yelling at me. So the marquee and the protozoal, they just keep the bug from growing. So while they're on it, it should keep things from getting worse. But the horse has to have an adequate immune response to kill it, right? Because you're not killing it with the drug, you're just holding it at bay. So if they don't have a good immune system, if they can't clear inflammation, if their liver isn't working, if their gut isn't happy, all these things we're talking about, that is how they got to this place in the first,
Ah,
if
yes.
that's not working, then when you stop the protozoal and you stop the marquee, it's going to come back. And so what we find a lot of times in the conventional world of medicine is that a lot of veterinarians are keeping horses on protozoal and marquee, usually protozoal, but sometimes marquee, for long periods of time, or they're doing pulse therapy where they get it, 3 days a week or 1 week of the month,
Oh my
for days
God,
and
that's expensive.
yes. And it's
Whoa,
not uncommon at all right now. And I think the reason that we're having to do that is that we have these horses that aren't healthy. They don't have a good immune system. They don't have the ability to clear infection. They don't have the ability to clear inflammation,
right.
and they don't have the tools to get better. So you have to keep this bug suppressed. Um,
No, and that kind of also explains the same horse. His numbers went from over 1,300 down to, I think, 400 after the first 30 days on Protozil. But clinically, he never improved. And he was one of those horses that had a lot of health issues, and he ended up, I think, he ended up seizing one morning. Like it went to his
okay.
brain and he would get up halfway and then he would just crash and he was
Oh
just
my God.
banging around the stall. But it was, he was just seizing. And so that was
Mhm.
when I lost him. But we had put him on a second, his numbers went down significantly. I was really impressed, but he just, his body just could not, it kind of explains that it's holding him, but his body obviously wasn't clearing it out fast enough.
Right. Yeah,
Yeah.
you have to get the body to help with that. So I will often use a different combination of EPM meds that so the reason I started using it is that I had talked to some of the vets at University of Florida, and I had a couple cases that weren't responding to Protozil and the
Hmm.
Marquis, and they had suggested it. So that was kind of where I started using it. But it's a drug called decoquinate, which has been around since the 50s, and it gets used in the food animal world all the time for calf scours and diarrhea and all kinds of other things. And so there isn't really any reason for the pharmaceutical industry to be happy about using it because it's an old drug, right? So they
Oh,
can't make any money
they
off
don't
of it.
make any money on it.
Yeah.
And
So
that Protozil and Marquis is
right,
expensive.
expensive.
Yeah.
So decoquinate actually kills protozoa versus holding them at bay.
Can you
Um,
spell that for me, or do
yeah,
you have to look it up?
I know it's DECOQUINATE. So
DECOQUINATE.
the powder that you find for calves that you can find at feed stores is called detox. I mean, and so it's been around forever. And so what most of us do that use it is we get it compounded and we mix it with another dewormer that's been around for a long, long time called levamisole. And levamisole used to be used a lot in the days of tube deworming. Just a long time ago.
Yes, yes, I know. That's where I've heard of it.
Um,
Yes.
and so in large doses, it can be a little dangerous. It can be a little toxic, but what we use it at is a very, very small dose. And there are some studies, including in humans with cancer, that have shown that low doses of levamisole can be help with the immune system, and they can, help with colon cancer, and they can help with all kinds of other immune issues. So the combination is supposed to help kind of boost the immune system and kill the protozoa.
And
So
so
I've gone
that,
to that for
well,
most of.
there's a new protocol that's been sort of floating around where some vets are just giving the levamisole, and
Mhm.
some horses are having really bad reactions. I think they call it rebalance or something like that, but it was just the
Right.
levamisole.
I mean, low-dose levansol has been around for a long time. There's a lab in Florida. There's a doctor named Dr. Ellison that has a lab called Pathogenes, and she's been using ducocronate and levamisole for a long time. And what she usually does is have you do low-dose levamisole for a long period after you do the ducocronate, for the immune modulating effect. Um, but I wonder if you're using it on a horse that's already really debilitated without anything else. I don't think it's enough. It's just going to help the immune system, but it's not going to kill the protozoa.
Oh,
So
gotcha.
so
Hmm.
you have to use it in conjunction with something that's killing the protozoa. It's not enough on its own. You're just
Or at
helping.
least holding the body at bay like the protozoal.
Right.
Okay.
So I think that's the trick with that. So I'll oftentimes add that. And then I think that the other important thing is treating the gut and the immune system. So I use lots of protocols that have mushrooms or colostrum or some nice prebiotics in them, anything that's going to help that gut to improve. We used to just use straight colostrum, and we had this great company in Kentucky that was doing fresh frozen bovine colostrum, and it was amazing. And then they went out of business with COVID. So
Oh.
I know I tend to use a lot of the immubiome products. They have a couple different ones. They have a nerve boost and a spine and nerve, and they have one called lean muscle. And the company's really great. So if someone wanted to call them and talk to them, they will help walk you through what you need. They're really amazing.
Nice. What company was that?
It's called immubiome. Um,
Immubiome.
yeah.
Just,
So
and that's just for your particular horse. They can walk you through what types of pre or probiotics that might be
mhm.
helpful.
Yeah, they will usually help you figure out, like, for your particular horse, do you want to start with the spine and nerve, or would you be better off starting with their lean muscle or starting with their immune products? So they're pretty good about trying to listen to your particular situation. There's also, I'm gonna have to look this one up. There's another product, I think it's called Bounce Back. That's a pelleted product. If you have a picky eater, it comes from CEP, which is in Oklahoma. Let me see if I can find theirs.
That's specifically for EPM.
It's a really great product, especially for those picky eaters. The Immubiome products have a lot of mushrooms in them, and they have a lot of bitterness and smell to them, and they're a powder. So
Mm.
some of those horses that are the ones that smell their food and then decide if they want to eat it or not, really do not like the Immubiome products. So
Well,
I'm sorry,
that's
guys.
why we have oral syringes.
I know, right? Yes, yeah. For the people that are not willing to use the oral syringes, yeah, it's called CEP Bounce Back. And
CEPU bounce back.
CEP is the company, and then Bounce Back is the product, and it's also has colostrum and a lot of the same things in it, but it's a pellet. Really high grade. They do food. All of their ingredients are human grade ingredients, just like Immubiome does the same thing. So they're both very clean products with good stuff. So I usually add one of those two in along with my, anti-protozoal, and see how that goes. And then depending on the horse, we'll do things to improve the diet, decrease the inflammation. We'll treat the liver a lot of times to kind of get that working again so they can get rid of the inflammation in
Hmm.
their body. So it's all of those steps to try to get them through it, so that they don't have it come back, which can be a challenge. I mean, sometimes we have some that we still struggle with, but in general, that'll take care of it. There's a
And
company in Berkeley, California, that makes an herbal. It's like an Ayurvedic herbal called Cephacon. Sometimes I'll use that one if people want to try something, kind of more, more integrative, or
Mm-hmm.
they're trying to get away from all of the conventional stuff. I used that I had a horse that had really bad EPN that couldn't move his body. He looked like a skeleton. He couldn't lower his head to eat anymore. He couldn't get up and down. He was like one big straight board. And we tried all the conventional stuff. And then I put him on the Cephalon, and all of a sudden he could move his body. It was like in 4 days, the immobility
Wow.
kind of really broke out, and he was able to start to recover. So I
And
like
it's
that.
called
And if I have
Cephacon.
Cephalon, S like Sam, F like Frank, ACON. I
Okay.
have no idea what's in it. Can't tell you if it's clean or
I
not,
know it's
but
like the Chinese herb. Just have no idea what's in there. Yeah.
but that
And
one
then what
worked
do
really
you think?
well.
Do you usually add in the vitamin E? I know a lot of vets will put horses on vitamin E with any kind of anything to do with the spine, but particularly EPM.
Right. I don't think it hurts. I don't think it's the big answer that everyone likes to call it. I think if you do a good job with the diet, you don't need to add the vitamin E in. And I wonder about a lot of our vitamin E sources if they're not as great as we think they are. So I think a good vitamin mineral and a good diet that has some, nice omega-3s in it, that's not full of soy and canola and molasses, that and wheat, that really helps the body, is going to do a lot more for the worse than adding vitamin E.
Okay.
Vitamin E is just helping with free radical scavenging, right? So if you can find some other way to help with inflammation, then you don't need to do that.
So vitamin C would essentially do the same thing with free radical scavenging. Vitamin C, vitamin E.
Mhm,
I mean,
mhm.
yeah.
Great. I mean, they're all good. I just don't know if it's the end all be all that everybody thinks it is.
Hmm.
But I don't know if I don't think it hurts. I just don't know if it's as amazing as we
Well,
like
and
to
that's kind of why
make
I'm
it out.
asking you these questions because the protocol, if you do absolutely everything, it's like it's like the expensive surgery on your horse. Like it can just be so costly that it can be
Mhm.
prohibitive to some people. And I think having some alternatives to look at or how the horse responds to different medications is always a wild card. I go, so there's got to be like your horse, all the traditional stuff, and then with the Cephacon, all of a sudden, voila. Yeah,
Right, that was the thing for him.
yeah.
Yeah, and I'm kind of playing with a lot more of a deworming portion of it too. Like I think that we probably need to maybe revisit using more Panicure power packs, or I have a few horses now where we've tried like a very low dose ivermectin protocol for a long period of time, and we kind of see some results with that. So again, I think all we're really doing is treating the GI tract to decrease the inflammation,
And
right? So
boost
if
the
that
immune
particular horse
system.
has, right, you got it. So
Yeah.
if that horse has a parasitic issue and that's a component of it, then that seems to help. So it's really just kind of looking at what's going on with the particular situation and trying to treat that horse the best you can to get their immune system working.
And then do you have like your own, again, kind of strategy or different protocols with Lymes? And I know like in your area in Virginia, Lymes is a big ass deal. And in Florida,
Yes,
we,
we see it all the time here.
yeah, we have it, but nothing like I see in Maryland and Virginia. Down here, it's more likely going to be EPM over Lymes, and up there, it's more likely to be Lymes over EPM. And then Deb mentions these words like Ehrlichia and other tick diseases, and I'm like, oh my gosh. But do you,
Yeah,
because I know like the standard protocol, the little I know about Lymes was rounds of doxycycline. And and so
mhm.
what do you do for
What do I
testing?
do differently?
Yeah, or are there symptoms?
Huh.
Because I also see with Lyme's horses, kind of like the inflammation response, no two horses present the
Mhm.
same symptoms. I go, it's crazy. Every single Lyme's horse I've
And I think
encountered.
that
It was a different set of symptoms.
Yep. I think that's the hard part is, some of them will have classic symptoms like a fever or a swollen joint or something like that, which was what was seen initially. Some of them will be really tight in their body. Some of them will be cranky. Some of them will be hypersensitive. They don't want to be touched. Some of them will be overly reactive. I often find that there might be, some sort of reason why all of a sudden they got worse. Like maybe they got a joint injection and so they just had a whole bunch of steroids put in their body. Well, that allows the Lyme organism to proliferate, right? So if you have sort of a low grade infection going on and then all of a sudden you do a bunch of back injections or joint injections, then you can create a Lyme flare. Or maybe they just got vaccinated and they were doing fine until they got vaccinated, and the vaccine created enough inflammation in the body that you get a Lyme flare.
Mm,
So it can be, kind of layers upon layers as far as, what is going on.
right.
So we have multiple tests we can do. I use a dog snap test a lot of times in the field as a screening tool. It's off label that, nobody has done any testing to prove that I'm allowed to use it on horses. Um, but it's that little, test when you go into the small animal vet, they, take a little bit of blood and they check for heartworm and for tick-borne disease, and it checks for Anaplasma, Ehrlichia, and Lyme. And it's really only testing for Lyme that's maybe a month old, a month to two
Mm,
months old, So, in certain windows, but a lot of times we'll get a positive for one of those. So it gives us a hint like, oh, we have some sort of tick-borne inflammation in the body.
got
And
it.
so once we get that result, then I'll take, I have enough extra blood, I'll send it off and I'll do, a more of a traditional equine test. Like Cornell does an amazing Lyme assay for us that is for 3 different antigens. So the Lyme organism likes to mutate, right? That's how it survives in the body for so long. So when the
Uh,
tick first bites the horse, the Lyme bacteria has something on the surface that we call outer surface protein A. And that's on the surface for a few months, and then it changes to outer surface protein C. And then after about 6 months, it changes to F. So the Cornell assay measures A, C, and F, and you can kind of get an idea, is this something new or is this something 6 months or older?
right.
And we're dealing with a flare. And so that's a really helpful tool. And then we will send off to Michigan for anaplasma to get a number to know, is it high, low, how active is that infection? And so, just kind of looking at overall blood status and looking at that can make a big difference. Treatment wise, I tend to use minocycline over doxycycline. And that's a personal choice. Doxycycline is cheaper, but it causes more GI irritation,
Mm,
and it's less likely to be absorbed. So some horses don't absorb it at all. So I tend to go with the minocycline because I know that it gets absorbed and I know that it's a little bit gentler to the GI tract.
which we've
It's more
already
expensive.
showed
So
the
if I have
important part of that.
some,
Yeah,
right,
because if you're
yeah.
disrupting the GI tract with the medication, you're working against the immune system as well. Got it. Yeah.
Right, you got it. So I'm trying to keep everything healthy while I'm trying to heal it. So I tend to do that. I have used a lot of times if they have high fever, we'll use IV antibiotics for a few days just to get the fever down, and then go to our orals. So you can kind of mix or match that. So we'll do that. And then I have started adding in bromelain, which is a proteolytic enzyme, along with the minocycline. And there's some thought that that really helps improve the penetration of the minocycline into the tissues. So
Oh,
you're getting more bang for
interesting.
your buck. You're getting it into the tissues. So a lot of times we'll add in pineapple powder while we're using our
I was just
antibiotics
gonna
so
say,
that we
I
can get
make
further with it.
I make the pineapple tea out of the skins for the same reason. Yeah.
Yeah.
Mhm.
So we add that one in a lot. And then again, I really think one of the big things for me up here with the chronic cases was adding in the colostrum. We had, I don't know, like 5 or 10 horses when I first moved up here that had had chronic Lyme for years. And you would retest them and their numbers would never get really high, but they would never go away. And we put them on colostrum and they they clinically got better and their numbers actually went up. So it was like they were finally able to create an immune response to the Lyme
Mm.
versus before they hadn't ever been able to actually respond to it. So I think the colostrum really helps them to recognize the organism and then respond to it better, and
And
get healthier so
basically,
it doesn't stay around so long.
just to clarify, and so if people listening know, colostrum is basically the first bit of milk after a mare has a foal. The first bit of breast milk is the colostrum, correct?
Right, usually we're getting it from dairy cows, so it's cross
So it doesn't
species
matter
because
if
that's
it's
producing.
equine or bovine or it just
It
colostrum
doesn't seem
has,
to,
okay.
and it's basically antibodies. So what you're giving when you feed colostrum is you're not actually feeding lactose, you're not feeding milk protein, you're feeding antibodies. And I think the reason that works, my theory, which is totally a theory, nobody has ever, this is all just in my head. But what I think is that, um, you know, so when you have a newborn baby and they're getting colostrum, the reason they're getting it then is because they have an open blood barrier in their GI tract in the first 24 to 48 hours. Those antibodies are going directly into their bloodstream to live there for a couple months and protect them. But that
Mm,
doesn't happen when you feed it to an adult, right? We're not doing that. So
right,
I think
right.
what we're doing is that we're mimicking what good gut bacteria do. And what good gut bacteria do is they secrete antibodies into the inside of the GI tract to bind things that we want to get rid of and to help that body deal with all of the infection and the junk that it has and kind of, be healthier. And I really think that's all we're doing is the colostrum is helping the body to heal.
Mm,
And it's doing what normal good microbiome would do. So that it can start to heal. So, but I think it's really critical for getting that response, getting the body to start responding. So, again, nowadays I use a lot of immune biome products. I use the CEP stuff, anything I can find with colostrum and mushrooms in it as an adjunct with the Lyme protocols too. And then the other interesting thing that we've been trying, and I can't say that it's happened, that it's prevented all cases of tick-borne disease. But we've been using a lot of a product called OGS. It's
oh yeah.
organic gut
Mm-hmm.
solution. It's an organic biocarbon. It's made down in Florida. The owners are down in Ocala, Florida. And it's supposed to help with binding toxic, things, helping with heavy metal toxins and helping with the delivery of um, minerals to the right portions of the GI tract. I think it probably also does a little bit to help with those camera aperture junctions between the cells and communication and synchrony. I think there's something to do with the carbon helping with the communication there. I don't think we understand it, but there's some new studies coming out about that.
Mm-hmm.
So I have a lot of people that keep their horses on OGS the majority of the year now to help prevent a lot of the tick-borne infections
Oh,
in our area. And
interesting.
we kind of started it anecdotally because there were some cattle farmers in the area that had found that their numbers of anaplasma infections had dropped, drastically. after using OGS, and that's all they were doing. And so we started kind of playing with it. And I do think that it helps a lot with preventing some of the tick-borne disease that we would see. I don't think it's 100%. I've had a couple now that have had fevers in spite of it. But I do think it helps minimize how many of them end up with tick-borne problems. So I've been doing
Interesting.
that as
Yeah,
a
because
preventive.
I mean, it looks like charcoal when
Yes.
take a little scoop and I go, well, the horses eat it fine. Like I have no problem with them eating it. And my
Right.
mare who lost all that weight or lost all that inflammation, I noticed her appetite really picked up on that. Like because she's been a bit of a picky eater. She's an older horse and, you know, had the colic surgery and she really did well on that product, has done well on that
I think
product
it
and putting
definitely
weight on.
helps. Yeah.
Hmm.
I like it. It's still, when I've talked to the owners of the company, they say you can feed it with everything else and, it's fine. I don't know. I still have a little bit of a worry that because it is sort of like charcoal, I kind of want to feed it separately if I can, just so that everything else is getting absorbed and I know it's all getting absorbed. But it may just be in my head. Like you probably can feed it all at the same time, but I tend to break it up and feed them separately just in case.
Oh, because it's going to
So,
pick stuff up.
but it may prevent the like if you were feeding charcoal, you'd be feeding charcoal to kind of keep things from being absorbed by the gut a little bit. So
Oh,
that's why
gotcha.
I just like to. I mean, it's not technically charcoal, and so it's more of a carbon than a charcoal. So I think that that's part of why it acts differently. Like we talk about it, they make a soil product that you can put in your soil that remains in the soil once you put it in.
Mm,
And it helps with root mass and nutrition in the roots, and it's supposed to really help with overall health of your pastures. And so I think if it was just charcoal, it wouldn't do that. You can't just put charcoal on your goat. It
right,
doesn't do that. So I think this
right.
is a little bit more natural than actual charcoal. So I don't think it works in exactly the same way.
Interesting. So we talked about tripping in a bad way for the wrong reasons. We talked about
Mhm.
inflammation, like especially if the gut is not healthy, you're also compromising the immune system. I think that's a big takeaway for me. And that it's
Mhm.
worth boosting, whether if we're boosting gut biome, we're also boosting immunity and hopefully vice versa. But if we're buying products just to boost immunity and we have an unhealthy gut, it's not going to have a lot of effect. And that
Right.
inflammation, whether we're talking tick diseases or EPM or even inflammatory responses to food or exercise, like even healthy work, you're going to have a little bit of inflammation from your osteopathy work or massage therapy or training. And sort of looking at how fast our
Yep.
horse's body can move that through would be a good indication of how healthy the gut is or unhealthy, how healthy the liver is or unhealthy, and how strong the immune system is. But yeah, I find that interesting because keeping the well, just keeping the body healthy. Um, I've had to deworm less, and the fecal counts like are fine. And the more they're healthy, it's like the less they're just prone to pick up whatever happens to be in their environment, or the body can
And I
bounce
do
back
think
from
that's
it
true.
faster.
I have wonder though if we are maybe not deworming enough anymore, like because I'm a little wondering. I just don't understand why this ivermectin protocol works if we don't have some sort of low grade, small amount of,
Parasitic load.
parasite missing. Yeah, yeah, there's got to be something there that we're missing.
No, and I'm a big
But I
believer in
think that,
deworming because I go Florida's a petri dish. And when I lived in South Florida, we were on a regular rotation of dewormers because it's a petri dish here. We don't get a freeze. They never die. Our high,
right.
like in the summer is our lower worm season. Our winter is our high worm season or parasite season
That makes sense.
because yeah, at least in the summer it gets hot enough it kind of kills everything, but not like a true freezing winter. Um,
Yep.
so yeah, just keeping them healthy. And thank you for going over all those details with some of the different protocols because at least people can talk to their vet about it and start exploring some options if their vet's open to it. And then
Absolutely. Well, and
True
if
North,
anybody wants to, I'm happy to, I can do a televet conference with anyone. If they just want to talk about their particular case, I'm happy to get on the phone with someone and go over some ideas for them too.
thank
So,
you.
you know,
So I
if
will put all
anybody out
your
there is curious, feel free to reach out.
yeah, all your contact details will be in the show notes, but it's North True North Equine in Marshall, Virginia.
Mhm.
And I know you treated a
There
client's
you
horse. You helped Nancy with her horse, Julius in Maryland. And
go. Mhm.
nobody from your office ever went down there and put hands on her horse, but that has been a beautiful recovery from EPM. Just a great
Yeah,
recovery.
I think the way I have to do it, like technically is, it's more of like I'm a secondary consultant in the
Hmm.
cases that we don't actually see, but I think sometimes just getting those ideas that you can then bring back to your vet and say, hey, here's some suggestions for these types of situations. What do you think?
Could we
It
try
just makes it
this?
easier to.
Right. Could we try
Mhm.
this? Could we try that? And then you're not also on your own. Your vet, there's a local vet checking on the horse and how the horse is responding. Absolutely. But it is nice to, a lot of times, local vets will get very sort of myopic in their protocols, and we think we don't
Right.
have a choice. But so that's good to know. I will put your contact information in the description box, show notes. So if people want to have a conversation with you about Lymes or EPM, that would be great.
Mhm.
Yeah. So I guess we better wrap it up. We've been yapping for about an hour or longer. Thank you so
All
much
right.
for doing this. I hope we
No
can do
problem.
more while your leg is healing because I'm happy to take
Yes.
full advantage. And I'd really
Great.
like to talk about osteopathy. Like I know you're an
Sure.
osteopath
Yeah,
as well as a
definitely.
vet, and I'd like to learn more about that.
Mhm.
So good. Well,
Yeah, we should
thank
do
you,
that. That would be
everybody.
great.
Thanks for joining us. We look forward to seeing you on the next
All
Horse
right.
Geeks
Take care.
podcast, and hopefully, Dr. Anne-Marie Hancock will join us again.